Hello everyone, this is Dr. Schroeder with this week's video introduction to week number 3 of a course in the Principles of Healthcare Research. And once again, a very nice week of discussion this week. The primary focus of the discussion, was really twofold. The first focus of the discussion that I gave most of the feedback in class this week on was that last part of the discussion question this week, which focused on research question. Your task was to identify a problem in nursing or a situation in nursing, and then to write a research question consistent with either a quantitative or a qualitative methodology. And the important takeaway here, the important thing to remember is that, remember, as I discussed last week, it's not the research topic that determines whether a study is going to be qualitative or quantitative. It's what do you want to know? What is the actual question that you're asking? This is true even if we're talking about doing a study on something that is inherently subjective. For example, if we're trying to identify the reasons why patients perceive their care to be higher care or lower quality care. In other words, if we're looking at patient satisfaction scores, or if we're looking at the reasons that nurses oftentimes feel burned out or emotionally drained in their roles. Those all sound like they're very qualitative, and indeed they may be a qualitative question. However, if we're looking to see what causes patient satisfaction to go up or down, or if we're trying to identify specific causes of what causes nurse burnout, that is by definition a quantitative study, because it means that we have to compare certain things. We have to identify what are the factors, or what are those things that most lead patients to feel that their care is high quality, and what are those things that lead to the highest patient satisfaction scores. So those are things that are measured quantitatively, and because of that, they would be a quantitative methodology. A qualitative methodology is used, usually it almost always starts with the statement in a research study that little is known about something. Little is known about the phenomenon of nurses and burnout and the difficulty of integrating or being a novice nurse, getting out of school and integrating into the workplace. So what is the lived experience of these nurses? What are their values, attitudes, and beliefs about nursing education and about the healthcare system? And there's no hypothesis, there's no expecting to see that they're going to come up with one answer or another. It's just a very open-ended question. And that open-ended question gives a lot of leeway for the researcher to explore various aspects. And a quantitative research study will not always, but usually have a hypothesis stated where the researcher gives a expected outcome, or at least a potential outcome, usually a couple of potential outcomes, where it's going to be either proved one way or the other. A qualitative research does not have a hypothesis. All that there really is just a research question and kind of a guided question, and with no expectation of what the results are really going to be. And that's kind of the basic differences between these two types of studies. It's important to realize that from this point on, because we're going to be talking from this point on about specific aspects of qualitative and quantitative studies, particularly quantitative studies here in the next couple of weeks. So it's important to have a little bit of that basic information down. Also, the other discussion this week was on the databases, and we'll be talking about the databases a little bit more this week. If you do not feel comfortable with, or if you haven't had much experience with getting into the professional databases found in the SHU library, please do so. You're going to need to do that, particularly, a little bit for this class, but especially when you get to your evidence-based practice class, you're going to be using it extensively, because you're going to have to find exclusively peer-reviewed information. You're just not going to find any peer-reviewed information on the internet per se. Google and Yahoo are not geared towards finding peer-reviewed information. If you do locate peer-reviewed information, it usually comes with a price tag, or you more likely are going to find something that looks like it's peer-reviewed, but it's not really. And so that's why the knowing how to use those databases, which is really where all the peer-reviewed information in nursing is held, it's important to really understand how to find that information. So understanding how to do a keyword search, understanding that the methodology that these databases use is not the same as Google and not the same as Yahoo. They don't have artificial intelligence trying to figure out what it is that you're trying to look for. And it doesn't GPS track you to figure out where you live to try to see if that gives it any information as to try to second guess what your search is really all about. It simply uses keyword matches. And so it's important to understand how to select, how to find, and how to use the correct keywords. Review my feedback from this week in the class. I left some feedback to some of you, and so please go back and review, because the feedback that I leave for some is really for all. Some tips and hints on how to do a good keyword search. That's really the trick. Once you figure out keywords and figure out how to do a Boolean search, makes it much easier. You'll be revisiting this topic again when you get to evidence-based practice, but it's good to get some experience with it now. And now going on to week number 3. In week number 3, we're going to come back to these two authors again, looking at these two topics of post-traumatic stress disorder due to childbirth and the efficacy of hand massage. And we're going to take it a little bit more structured this time. Previously, we've looked at these, really just looking about how they were the same, how they were different, and how they were consistent with a qualitative or quantitative methodology. But this time, we're going to explore a little bit deeper and understand that the first step in the research process, or one of the first steps, is to establish a need and establish a significance to do a study. One of the key tenets in nursing research is if we don't need to do a study, if we don't really have a need to know information, in other words, if we can't tie a particular study to a problem, really no sense in doing the study. And so here we're going to see, did the authors of these studies clearly identify the problems and significance for nursing? And how did they establish the need for that? Could it have been made more clear? And then in the Beck article, we're going to talk about the lack of a formal hypothesis and absence of an independent dependent variable. Was that justifiable? Was that correct in the Beck article? And if so, why? And if not, why not? And that will be the bulk of our discussion this week. Remember, next week we have our midterm evaluation coming up, or excuse me, our midterm examination coming up. So please remember to be reading through and be reviewing the statistical concepts. I don't discuss them directly, or I don't teach them directly. However, there are materials and there are texts available for you to learn that. But that's pretty much something that is learned on your own independently, and not something that's generally going to be a focus of the videos or the course materials per se, or the discussions per se. If you have questions, please feel free to let me know. I can go ahead and clarify those. Usually in the Ask Your Instructor box is a good place to post any questions about the statistical concepts, and I can add some clarity to that. So for any of you living down in Florida or in the Georgia area, please stay safe. I'm recording this on Sunday morning, so the Hurricane Irma has just passed over the Keys. I personally have friends and family in Tampa who thought that they were going to be sitting pretty, and of course now, as of last night, are in a shelter. So please stay safe, anybody that's down there. Our thoughts and prayers were with everybody. Everybody else is in the storm's way. Please stay safe. And at any rate, please have a great week. I look forward to participating along with you in the discussions again this week. As you have questions, let me know, and we'll see you in the discussion forums.